them up from our website, and you can take a look at those more closely. You can check on the links provided, all the flyers that the speakers and others share with us for this call. Let's open the chat box. You're welcome to write your name, contact information, a web link you want to share. Because as we're using now the Teams platform, all this gets to stay, and you can get to look at it after the call. And it's 9 o'clock, so let's get started. We have a full lineup and interesting topics today. So officially, I do want to welcome you to our Chula Vista Community Collaborative Partners meeting. Today is February the 9th. I am Brendaly Rodriguez, Director of the Collaborative, and there's our web page address, so you can explore more of our services, resources, and hours of operation and contact info. Also, we will be uploading soon some videos and statements from our staff members, just for you to have a face to the name. And when you send referrals, you speak with one of our staff members across all 5 family resource centers, you get to know a little bit about them and why they are so proud and so happy to be a part of the Chula Vista Community Collaborative. So David is working on that project and is going to be uploading some of those videos that our staff, very brief, 30 seconds, 1 minute, and it's just to make more of a personal connection. Now that we cannot meet almost like for about a year now. So let's just get started. Next slide, please. So today we're going to give some updates, and I'm going to discuss a little bit of the topic of health equity and how not only we are addressing and integrating health equity into our activities and thinking and planning for 2021 and beyond, but also an invitation to you all. And I will share a resource from the Robert Wood Johnson Foundation, and the link is going to be provided in the slides. Also, we're going to get to hear from partners, very brief updates, and also actual presentations on several topics today. And we will open the floor for announcements and discussion of needs. Our next call is going to be March the 9th, so please write it down in your calendar. Next slide, please. So one of the topics that has been coming across and being brought up in several advisory groups and discussions and online and also on several schedules is the concepts of health equity. And I usually integrate this slide in my webinars, making the distinction between equity and equality. Because equality sometimes it looks fair, right? Giving everybody some resources to get them where they ought to be in terms of health, physical and mental. But as you know, we all are different, have different needs, and there is the clear movement of not using a one-size-fits-all strategy, as many of you know. So we are really looking into more tailored strategies, more tailored solutions to address the challenges that we're facing now. And now more and more, we're integrating discussions of health equity, both in the COVID response and also the vaccination and education efforts against COVID-19. And being February, this is the Black History Month, and right after the holiday of Martin Luther King, I really wanted to share with you one of my favorite quotes from him. I took that from one of the from his monument in Washington, D.C., and is engraved in the wall, beautiful. and really makes a connection with the kind of things that we're doing here and many of you in your organizations. Because in terms of uh, provision of basic services, it's not only the physical meals per day, but education, culture, and the issue of equality for all of us. So I admire that quote very much, as equity as a goal, unique solutions tailored to individuals' needs. Next slide, please. And specifically with COVID, I really invite you to take a look at this issue brief from the Robert Wood Johnson Foundation, just came out last year, regarding 5 principles. So don't forget to collect, analyze, and work on the data to really tell the rich story of our communities. Those stories need to be told. And one of the things that I was facing back in Florida is like aggregated data with African Americans, for example, was not very specific on the inclusion of Haitians from Haiti, for example. So we really needed to take a closer look at how we were collecting the data, analyzing and reporting that data. And that's one of the basic principles for achieving health equity, really telling the story in through many angles and directions: ethnicity, gender, disability, and other sociodemographic characteristics. Um, a second principle that and you can read more about it in this issue brief, is about the integration of the people that are most affected. So either clients themselves, client advocates, family members, community health workers, they are voices that need to be integrated for the service to be more client-centered, more patient-centered, depending on how you call your constituents. Also, integrating more the voice of the staff members, the members of their teams. We have done here at the collaborative a lot of requests for feedback and having meetings to integrate the staff perceptions and opinions, recommendations, and we assess that in those 7 months that I've been here so far, and always having the client centered in our response and recovery efforts. And looking for those service gaps. In our case, as I would imagine in many of yours, when you're assessing what has been happening after the COVID transition until now, for us, we have identified several service gaps that needed attention, especially, and I will tell you more about it later, with some digital divide, and we have come up with some strategies to mitigate some of those service gaps, not only for our clients, but also for ourselves at the CVCC. And lastly, there is a need for investment in that infrastructure to foster that resilience. And in our case, we have been looking at how to invest, not only with looking at salaries, looking at benefits, but also looking at a time off, acknowledging mental health breaks, acknowledging that is an important part of the package. Also, technology and getting up to par, or at least more advanced in terms of the equipment and technical support, not only for clients, but also for our staff. So I invite you to take a closer look at this very brief publication from the Robert Wood Johnson Foundation. Next slide, please. And as many of you know, we have at the collaborative 5 family resource centers, which the goal is to provide a safe and accessible place for families to connect with us, in a place with no wrong door policy, but rather with an approach to initially to screen, stabilize the situation, and that's how they came to us, and also strengthening the family unit So hopefully we will make ourselves extinct in some years from now, because we would have increased capacity not only at the individual but at the unit level. Next slide, please. And yes, even though the schools are still closed, at least in our district, we are open. We are in the facilities of specific elementary schools and one high school with Sweetwater. The locations are there. You're welcome to give us a call or make some referrals and contact them. Our website has all that contact information. Next slide, please. And telling you a little bit more about how we have implemented those COVID response and how it has impacted our operations, just like with many of you with our sites. We have now some modifications to our staggered schedules with the staff, physical modifications, the services we are providing on the phone and on by appointments in the service windows with physical barriers and protections. We have put more thought into the website, and David has updated the COVID page. I urge you to take a closer look at that with timely links to not only local, regional, state, and national organizations. And of course, the information in Spanish. We have to cater to the socio-demographic that we serve. We continue to do Mask Mondays from 2 to 3. And Azucena told you a little bit about that last call. We distribute masks and hand sanitizers here at our Vista Square location, Beacon and Admin. And we have done some drive-through distributions and contactless events. We could plan to continue to do more, so stay tuned for those. And this is one of the items that I made reference earlier regarding the digital gap mitigation. We have identified that as a gap. We have worked with older Latinos, adultos cibernéticos, with our community resource specialists and promotoras. We have integrated some laptop distribution for some of our needy families in our holiday past event, and will continue to provide technical support and improved laptops and services to our staff. We have had to overcome that in terms of now that shift to virtual services, and we have had to come up with the times, and I'm sure that many of you are also going through that transition. We're also shifting from the face-to-face provision of some services like the mental health support program that many of you may know. Es difícil ser mujer, it's difficult being a woman, and we are making that as a pilot now, currently undergoing, so we can switch that and learn from how to make it engaging and still warm and welcoming to this women participants in this program. Next slide, please. And I am finalizing one survey that will include now some one or two questions regarding health equity in times of COVID. So as part after the call, we can receive that, and we would like to hear more about what your stories are. Next slide. And here I am going to list some of the, very briefly, some of the quick updates from some of our partners before we go into the main presentations of the day. Remember to write your name and organization and any contact info you would like to share with the rest of the group in the chat log. And right now, I just wanted to remind organizations that you can inform your constituents about the SDGE programs. That is an important resource that we use a lot in our FRCs and integrate that into the needs assessment, especially now in times of COVID and unemployment and lack of income or reduced income. We have to cut corners and take a closer look at all the financial situation of the family. Next slide, please. We also have some updates regarding the COVID testing. And let me see if Maria Mila is with us and she can give the update herself. Are you here with us, Maria? I can do that for you. We have there, and you will receive once you download the materials, that they have free COVID testing, English and Spanish at the Nestor United Methodist Church. This is in a zip code area that is troublesome in the sense of increased rates of COVID. So definitely this is a resource that you can share. The flyers will be available in the zip drive that you will download after the call. Next slide. Another update from our friends at the YMCA. Miriam, are you here today? Well, I can give you that update as well. She shared with us some activities that are going to happen now in February the 20th regarding fitness, regarding availability of programs at South Bay. So please take advantage of those and share the information once you download it from the call materials later today. Next slide. And here are the actual presenters with time today. It's a full house, so we're going to pay very close attention to the time so we can incorporate everybody's questions and comments after each speaker. So we begin very briefly with Nadia Morehouse, and I invite you guys to go to their website. She doesn't have slides, but I think that she has a nice message for you regarding Casa Familiar and their services. Nadia, are you here with us?
Yes, I'm here. Hi.
I think David is going to just put up the website, so at least that's a visual cue.
Okay.
Take the floor.
Okay, so do you want me to start now?
Yes.
Okay. Hi, good morning. My name is Nadia from Casa Familiar, and I like to share with you guys some little information that we help here in Casa Familiar. We help like people to help to reduce. We have two programs they call teaming changes, and we help people to reduce the light bill and reduce the internet or cell phones or house telephone bills. If you know that someone that needs help right now with this COVID problems that we have right now, they need help, like they don't have money to pay the light bill or the telephone bill or the rent, they can call us at 619. Hold on, I have the phone number right. 619-333-6824. We can help them to pay their bills right now. And also they can come if they have a high bill on the internet or the telephone or the light bill. We can help them with that too. That's my little message that we have. I have these two programs here in Casa Familiar.
Thank you, Nadia from Casa Familiar. You can always type in the chat those phone numbers that you provided so people can keep those.
Sure, I will. Thank you.
Thank you for coming and joining us today. And yeah, somebody is asking for those phone numbers, and so Nadia is providing that. And also, if you can provide your contact info, Nadia, so people can follow up directly with you. We have several questions to you regarding the requirements
Okay.
and of those programs. Can you briefly mention some of those requirements?
Yes. You can qualify. You need to be resident of the South San Diego International City to San Isidro. For this, you can qualify for these programs. You need to have proof of that your income went down. You need to prove your age and any bill that is gonna be passed due, or any also you need to prove like and you need to take like virtual section. So someone is gonna call you and let you know all these requirements too. So the phone number again, I'm gonna put it on the chat. It's 619-333-6824. But I'm gonna put it on the chat right now, okay? With all the
Yes, yes. We have a lot of responses and questions for you
okay.
on that.
Yes, I will answer right now.
Excellent. Thank you.
Thank you.
So we also have our next speaker from the San Diego Continuing Education, and he also has several updates to make. Let me see. Do we have the speaker for San Diego? Going once, going twice. Maybe we will move on to one of the other presentations that we have in store and then come back to this one. We have also scheduled the Goodwill San Diego County presentation. Maybe Tavaris will join us afterwards for the San Diego Continuing Education, but right now we can take a look to see if Ashley Czech. Ashley, are you here with us?
I am. Can you hear me?
Yes, fantastic. Great. So just let David know when to pass the next slide.
Sounds good. Will do. Thank you for having me. My name is Ashley Czech. I'm the Community Employment Manager with Goodwill Industries of San Diego. I'm not sure if she's on the phone, but I also wanted to introduce my coworker, Erica Apodaca, because she actually oversees our Chula Vista office. And I'll put both of our contact information both in the chat, and then it's at the end of the presentation as well. So most people are familiar with Goodwill, of course, for our retail stores and a place to drop off your used clothing and things like that. But the mission of Goodwill is actually to provide training and employment opportunities to people with disabilities and other barriers to employment. So our community employment centers, along with some of our other employment programs, are really how we make that mission happen. So today I'm going to be talking to you a little bit about our services that we offer at the community employment centers. All right, next slide, please. All right, so we operate 5 community employment center locations throughout San Diego County. Most importantly for this group, I think, is our East H Street location in Chula Vista, which is located at 865 East H Street. It's actually within our retail store. We just opened this location last year, so it's pretty new. We're really excited to be in the community there. Chula Vista in particular is open from 10 a.m. to 4 p.m. The rest of the locations are 9 a.m. to 4 p.m. Currently, due to COVID, we are operating on primarily a remote services basis. So when possible, we are conducting all of our services online or over the phone. We do realize that there are individuals that don't have access to computers, don't have access to internet. So we do have appointments available for in-person at our community employment locations. The best way to make an appointment, I'll demonstrate this at the end if possible, but you can either call the location directly or make an appointment online. All right, next slide, please. So the first thing that a job seeker can do when they contact us is we'll set up an appointment to do an enrollment with the job seeker and then really go through kind of a career assessment to determine where the job seeker is in terms of his or her employment plan, what they're looking for, what they need, what their short and long-term goals are. And then from there, the Career Centers will really walk job seekers through all the steps needed to get into the job that they want. That can include, staying up to date on the employment plan, helping with the job search and providing support, with that process, either creating a resume or updating a current resume, helping to complete those tricky online job applications, and then helping to both practice and prepare for interviews now, of course, in person, but also for those virtual interviews. All right, next slide, please. All right, so in addition to our one-on-one appointments that we offer, Goodwill also offers a series of workshops. All of our services are free, by the way. They're no cost to the community, funded through our employment, or excuse me, our retail operations. So the 5 workshops that we offer currently are acing the interview, which is, help with preparing for both an online or in-person interview, how to prepare, what to do as a follow-up, workplace communication, so how to communicate effectively in the workplace, the importance of verbal versus nonverbal communication, how to avoid miscommunication, really good kind of workplace skills. Online job application, so that's both helping with those online job applications and also navigating, online search engines and things like that. Our resume workshop, which can either help with creating a new resume or updating an existing resume. It'll also talk about, the different types of resumes and which one's the most appropriate for the job seeker, and what to include and not to include on a resume. And finally, conflict resolution. So how to learn about, different conflict styles, how to approach conflict in a way that's a win-win situation. Again, really good workplace skills. And currently these workshops are being offered completely virtually. We also utilize Microsoft Teams or Zoom or whatever really the format is best for the job seeker. But again, if internet access or a computer is a barrier, job seekers can always come into the Employment Center as well with an appointment. Next slide, please. All right, so a unique opportunity that we do have available within our community employment centers is our Job Readiness Certificate. A job seeker can obtain a Job Readiness Certificate by completing the 5 workshop series, as well as meeting with a career advisor one-on-one 4 times. Then they will get an actual physical certificate in the mail after completing that. And it's a great way to kind of demonstrate some, soft skills to employer. By completing this certificate, they can demonstrate reliability, commitment, and initiative. And something we can do as well, we do these on an individual basis, of course, for job seekers that come in through either our website or calling. But we also partner with a lot of agencies, adult schools, different programs to offer the Job Readiness Certificate as part of the program. So if that is of interest to any agencies that are on the call today, I'd be thrilled to talk to you further about how we can possibly partner to offer either individual workshops or the entire Job Readiness Certificate to your clients. And I did want to mention too, both of our in-person one-on-one appointments and our workshops are offered in both English and Spanish. All right, next slide, please. All right, so in addition to our job readiness services, we do have several other, resources and services available within our employment centers. We partner with different programs to offer workshops that are kind of above and beyond the job readiness topics. For example, we're currently working with Bank of America to offer the Better Money Habits series, which is a series of financial literacy workshops. We partner with local employers to offer hiring events or to host hiring events and information sessions. Right now, of course, we're again in a virtual environment with our information sessions. But currently we've worked with Amazon, we've worked with GMI, Ace Parking are some of the big ones. And in addition, as well as, hosting these events, it's helpful to have these employer partnerships because we're able to refer our job seekers directly to open positions. So our centers also act as kind of like a one-stop for our other employment programs that we offer at Goodwill as well. In addition to the employment centers, we have a Ticket to Work program, which works with job seekers that are currently on SSI or SSDI and looking to find full-time employment. We have a young adult program. We have a supported employment program, a veterans program, Department of Rehabilitation direct placement, as well as a paid training program, which is a 3-month on-the-job retail training program. So getting started at the community employment centers is a great way to learn about eligibility for other programs that might be an option for job seekers. And finally, our career advisors within our centers are really community resource experts as well. So, if a job seeker needs access to a particular resource, it's a great place to come. So, for example, we recently all completed the Hunger-Free Navigator training through the San Diego Hunger Coalition, and all the career advisors recently participated in the mental health first aid training through Mental Health America as well. All right, next slide. So I don't know if I can access this through the link here to get onto our website. I can try, or I can kind of explain how that might look. I don't know if it'll link. Perfect. Thank you. So I just kind of wanted to give a little bit of an explanation of how a job seeker can get started on our services. Of course, they're always welcome to call one of the centers as well. But if you'll scroll down actually, let me mention first up top on this top bar here are all the different programs that we do have available, so you can learn more about those through our website. Our main address is SD, says in San Diego, sdgoodwill.org, and then you can navigate to the Community Employment Center page. So under Job Search Assistance, you can click on Schedule an Online Appointment with a Career Advisor. Awesome, thank you for your help. And from there, you'll get the option of scheduling either an English or a Spanish workshop. You can choose the date and the time, and then you'll enter your contact information. And a career advisor will reach out to you to confirm your appointment, determine if a virtual format works for you, or if you have, if you need access to a computer and need to come in. You can access the workshops to register online as well. So again, underneath free workshops, it will list all the different workshop options that are available to you. Thank you. Perfect. So a little description of the workshops that are available. And then if you continue scrolling down, this also talks about, the ones that we have in addition to our job readiness ones as well, like Better Money Habits. So really simple, you'll just enter your contact information. You choose the workshop that you want to attend. Make sure that you're not a robot. And then again, somebody from the Career Center will contact you to confirm your workshop. You don't need to do anything special to enroll in the job readiness program. But that's a great way to get started with that certificate program, is by signing up for a workshop or a one-on-one appointment. All right, thank you. Find a community employment center. That link gives all the different locations, phone numbers, and hours. So that's a great way to, if you want to just call the employment center. I do see a question, is there an age requirement? Great question. 16 and up, we would probably refer a client to the young adult program if they're 16, but that is the age requirement. Thank you for asking. Find a community employment center, we did that. And then there is some information about our paid training program as well listed on this page. I'm not going to go into that too much, but if you do want any additional information on our paid training program, it's a great way for people to start getting some job experience within Goodwill that maybe have a barrier to employment, haven't worked in a long time, something like that. But we'd be happy to share more information about that if that's of interest.
And actually, relevant there is the incoming question about any clothing for interviews. I know that there are programs that specialize on that, but just wanted to know, Patricia is asking if the Goodwill program will provide any clothing for those interviews.
That's a great question. We currently do not offer, a voucher or anything for interviews. but we kind of help with, what's an appropriate way to dress. And Goodwill, Goodwill is a very reasonable place that somebody could obtain an interview outfit, but unfortunately, we do not offer interview clothing. Thank you for asking.
And also, just to highlight, we also have a closet that it doesn't specialize on job interview clothing, but it has a wide variety. So we at the Rayo FRC, Family Resource Centers, we do have access to closets free of charge.
Oh, that's great. Thank you. Yeah, and we can always refer to you at that as well. So I appreciate that. Great. Well, that concludes my presentation. Again, I listed my email and my direct number here, so please feel free to reach out to me if there are any other questions or you have any interest in partnering on the job readiness program. Again, it's a free service. I also listed Erica's contact information here. She is the head career advisor in our Chula Vista location, and you're welcome to reach out to her with any specific questions as well.
Excellent. Thank you so much,
yeah,
Ashley.
Absolutely. Have any other questions? I think
I'm also checking the chat log, but I think that those are the questions that were asked.
Great. Thank you so much.
You're welcome. Have a fantastic rest of the day. And let's prepare for our next speaker. And Angel from Molina Healthcare. And just full disclosure, we at the CVCC, we do have a navigator program that expands the role of the promotores de salud and a community health worker into kind of a care coordinator. And that is a pilot program that we are now in our second year, working with a couple of insurance payers, and one of them is Molina Healthcare. Let me share the stage with you. Angel, are you here with us today?
Hi, can you hear me?
Yes, we hear you loud and clear. Speak louder.
Hi, everyone. My name is Angel Puente. I'm the Senior Specialist in Community Engagement for Molina Healthcare for the San Diego region here. And thanks for having me today, Brendaly. I look forward to the presentation. Can we move to the next slide, please? So our first slide here is just an overview of who we are in the state of California. We have a membership of about 575. An estimate of 574,000 members. There's some information here about the different lines of businesses that we have, but I'd really like to highlight that on this particular slide here, we've just gained some recent new leadership at Molina for California. So we have a new plan president, and she's listed at the top. Her name is Abby Totten, and on the left side, we have some recent news that we're sharing with everyone. We've donated about $320,000 in personal protective equipment, of 10,000 tests and 27,000 masks to over 66 skilled nursing facilities and 60 community-based organizations. Since March, Molina committed to over $275,000 in monetary donations to community-based organizations for COVID-19 relief efforts throughout the state. And we've also launched a COVID-19 member wellness campaign, which I'll be touching a little bit about in the next few slides. Can I go to the next slide, please? So these are just some of the pictures of the local work that we've done here. On the top left picture, it's a picture from Cecilia Guzman from La Ventanilla de Salud. There was, and then on the upper right hand corner, there's a picture of food boxes that were put together for for Meals on Wheels. And at the bottom was actually, we partnered with the National City Family Resource Center to provide them shopper bags so that they could put together some food items for the local community there that they help with the local community in receiving food. So we've provided about over 1,000 items of food to organizations across the state, helping individuals and families in need. Next slide, please. So this slide is a little bit about the way that we deliver our services. So we're contracted to do the Department of Healthcare Services to offer Medi-Cal in the following counties. As you can see, we operate in Imperial, Los Angeles, Riverside, Sacramento, San Bernardino, and San Diego. And may I go to the next slide? But just if you have any questions, I'm not able to actually access the chat. I should have said this from the beginning. So I can't see any questions that pop up. So if I can get your help.
Don't worry, we will bring them up as relevant or at the end of your talk.
Okay. So this is just touching on the different lines of businesses that we have. Our Medi-Cal line of business, Medicare, our duals, which is our Medicaid, Medicare, and our marketplace. So that's just the exchange that we have. Next slide, please. Oh, wait. So this slide right here is talking a little bit COVID-19 and whether or not we cover the cost for our members. So we do cover the cost as long as they meet the guidelines for the testing and have a doctor's order. The testing can be done in any approved laboratory location at no cost to the member themselves. And about their regular prescriptions, unless a doctor disagrees, they can have a 90-day supply of their medications. They get their early refills, and they're also able to get free home delivery for their prescriptions. And that's something next slide, please. So these are the different services that we offer for through Molina for our members. We have access to quality doctors, transportation services, our Molina Mobile smartphone app, prescription coverage, 24/7 nurse advice line that our members can access so that they can call a nurse and speak with them if at any point they have any concerns about their health or someone within the household. These are the different numbers that they would be able to use to access those services. And also listed is our Molina member service line. Members able to not only call the number, but they can also get more information online on our website, molinahealthcare.com. So, and the last number here is if a prospective Medi-Cal beneficiary is interested in enrolling with Molina, they would be able to call the 1-800-643-7276 number to get more details on regarding enrollment. Next slide, please. So this slide right here is something that we're really trying to get our members aware of and let them know that they can have access to this Molina Mobile app that we're trying to really get out and disperse in the community. It gives them the ability to see their member ID cards in a digital format. For our marketplace members, they're able to do their bill pay online. So that's just for those accessing Molina through Covered California. And they're able to use a nurse advice line to get the care that they need, so they'd be able to use that to connect with the nurse as well. They're also able to find a new doctor, change their doctor, even view their provider contact information if they may have forgotten that, or they weren't sure if they had changed that information. And additionally, they have access to their health records and their benefits and eligibility. So next slide, please. So right now, throughout the state, our employees are actually working on our member wellness campaign. So we're making a concerted effort to reach over 50,000 members, and we're doing this by making daily calls and making sure that our members are doing well during COVID-19. So we asked them about whether they're able to access food, and if they're not able to access food, we provide them resources on where they can go, or refer them to the state website where they can also get more information if they to be more researched, if they like to do the research themselves. But we do provide that information over the call, so that way they can learn more about what they have available to them, and that way they can also access it. So part of the other critical information updates that we provide is letting them know about that Molina smartphone app so that they can have access to that information that they're able to access on the application. Just because, you know, we get a lot of members who, there is a lot of people who may lose their health plan ID card and not have access to that information. But if they're aware of the smartphone app, then they can register on the smartphone and access all that information digitally. It facilitates the ease of access for them. So we also touch on the different services available to them. So we have our health education courses. We let them know about the upcoming ones, since we do them on a quarterly basis, and those are managed through our cultural and linguistics department. So we let them know about the ongoing ones, the ones that are coming up, and which ones would really tailor to their specific needs. And I kind of went ahead of myself and already touched on the mobile platform. So next slide, please. So one of the benefits of being a Molina member is that they're able to access transportation services. Our members are able to call and request transportation to and from their doctor's appointments. So if a member doesn't have, you know, they don't have a reliable transportation, they can always call, make the request, as long as it's within 72 hours notice, and they're able to, they provide the information. So their health plan ID number, their name, where they're going from, to their pickup location to their drop-off location, and then vice versa for their return back home. So it really facilitates their access to their medical care, because they're able to get to their doctor's appointments and get back home. Next slide, please. So one of our updates for Covered California this year on January 25th, Molina actually expanded, well, we entered into a long-term agreement with Scripps Clinic and Scripps Coastal Medical Center to extend healthcare services throughout the Covered California Health Exchange, which is just our marketplace members in San Diego County, and effective immediately, the partnership will significantly increase network access to care. So through this expanded partnership, where basically our members are going to be able to access 1,000 primary care physicians, medical specialists in obstetrics and gynecology, cardiology, orthopedics, neurology, diabetes, and more. There's also some different locations throughout San Diego County that they're going to be able to get those services that they need. Next slide, please. Our last slide, and I just wanna, this is my contact information if you ever need to reach me. Below is actually my manager's contact information, and I want to highlight then that there wasn't a slide for this, but I know that this meeting is particularly for our community-based organizations, and if there are any kind of educational materials that you might need, or Molina specific materials on services that we offer that you find would be beneficial to you and your clients, please feel free to reach out to me so that we can get those to you, and that way we can make it happen. If you have any questions, also please feel free to call or email me. I appreciate you letting me present today, Brendaly.
Of course, thank you. I'm browsing through the meeting chat log, and this is the time now if you have a question for Angel regarding services and those engagement activities that are available as resource. We have several comments there thanking you for the information.
Thank you.
Okay, well, let's, we have one more speaker, and then I think Tavaris was able to join us after some misconnections. from the San Diego Community Collaborative. How about if we go with the order and get more on COVID? And this is an interesting angle regarding the long haulers. And I do want to leave the opportunity for our speaker, Andrea Garcia, to actually talk about that definition. And David, if you can put up the slide for Andrea Garcia on COVID-19 long haulers.
Just 1 second.
Okay. This particular slide set has a video, a testimony of one of the nurses that not only was providing services, but was also a patient of COVID-19, and she recovered. But her recovery journey has been long. I wanted to have the opportunity for her to be here. She is providing direct service delivery. So Andrea is going to incorporate her testimony of this long hauler nurse into her presentation. Andrea, are you with us today?
Yeah, I'm right here. Good morning, everyone.
Good morning. And tell us about the organization that you represent while David pulls up the slide set.
Yeah, I'm from Scripps Mercy Hospital in Chula Vista. We have a little tiny department called Community Benefits, so I work out of the Wellbeing Center. We provide kind of like educational classes. We follow up with our patients post-discharge to try to do that continuum of care of services and resources if we can. We also do a couple support groups for breast cancer survivors or people going through breast cancer, a stroke support group, and other things like that. So a lot of what I do is community education, health promotion. I'm a master's of public health graduate, so a lot of what I do is public health. So this presentation isn't necessarily trying to promote anything of trying to diagnose the long hauler. I'm just trying to disseminate the information, hopefully gaining knowledge from this presentation. So I'm going to go over the COVID-19 long haulers. So with the pandemic starting in March, we honestly didn't really know much about COVID-19 in general, how it affected our bodies, what it was doing, what kind of damage it could impose on our bodies. After a few months into this, we realized that we needed to create a vaccine really quickly. So that kind of started way at the beginning of the year last year. By the end of last year, we were noticing that some people that had been, that had the virus, that had COVID-19, sometimes their symptoms weren't going away. And we just wanted to kind of know or do our research as to why are these people still experiencing symptoms, what's happening in the bodies, what kind of symptoms are they experiencing, and just kind of gathering all that information because it's such a new topic still. And even till this day, as I tried to look up more information last week, it's still pretty unknown and there's still just information being gathered. So I just wanted to kind of share that information today. So next slide, please. So some of the things that I'll go over is a basic definition of who is a long hauler, who is at risk of becoming a long hauler based on what research has been gathered so far, what are the most common symptoms that long haulers experience, which organs are impacted, how to function with chronic disease and long COVID in general, whether that's heart failure, that's COPD, one of those long-term chronic conditions. I'll also go over just kind of summarizing the developments, what we know now. And then as Brendaly shared, I have a testimony from a long hauler. She was a ICU nurse at our hospital in Chula Vista, and she ended up contracting COVID. So she has a little short video of her going over everything that she's experienced and everything that she has gone through. Today, she's back in the hospital working. I don't believe that she's back in the ICU yet, just because that is a very high risk situation to be in. And with the symptoms that she still experiences today, it would just be a high risk for herself to be in that situation. But she is back working at the hospital, and I'm really excited to be back with patients again.
We thank her for her service.
Yes. So who is a long hauler? So these are people that are said to be suffering from long COVID, meaning that typically how we've seen so far, maybe someone has COVID for about a week, 2 weeks max. At the beginning, it's the fever, it's the cough, it's the fatigue, muscle aches, and then probably like a week in, sometimes they're experiencing that loss of taste or smell. What we've noticed with long haulers is that sometimes they're not fully recovered from COVID-19 weeks or even months after first having symptoms. So to the example of our nurse, she contracted it in July, and to this day, she still has long-term damage and symptoms from then. So as you can tell, it's been months and months, and she's still suffering or still experiencing those symptoms every day. So just to kind of break it down, the two groups of people affected by the virus that are long haulers are those who are experiencing permanent damage to these primary organs of their lungs, the heart, kidneys, or the brain that may affect their ability to function. And then also there's those that just continue to experience those symptoms, such as a cough or a headache and fatigue and whatnot, but they have no detectable damage to these organs. So as you can tell, it's kind of a long, different variety of damage to these people or of symptoms. It can be as simple as I still have a cough a month after contracting COVID, or it's I have now a neurological disease, or I have brain lesions, or I have permanent damage to my lungs. Next slide, please. So who is at risk of becoming a long hauler? As we all know, anyone can be at risk for anything, especially with COVID is what we've noticed. It can be a 3-year-old child up until someone late into their age of 70, 80 years old. This disease or this virus has no kind of definition of who should get it and who shouldn't. So just some 5 main factors that were found from researchers from King's College London, which have actually been cited multiple times if you try to Google long haulers. So some of the things that they found out from the people that were documenting their symptoms were that they were older. Sometimes they're overweight or having a slightly higher than average BMI. They're also more likely to be female. Having asthma, which from the beginning we knew that it really affected kind of like your lungs and affected a lot of people that get COVID sometimes even contract pneumonia. So having asthma is one of those pre-existing conditions that kind of put you at higher risk. And then also having experienced a greater number of different COVID-19 symptoms during their first week of illness. So from personal experience, I know someone that had just kind of a little light fever for a day, had a little cough, and then kind of just lost her sense of taste and smell, versus knowing someone else that had fever, chills, had muscle fatigue, body aches, just a lot of these primary symptoms. So basically, if you've had more symptoms in that first week, you're more likely to become a long hauler. Next slide, please. Okay, so that study kind of examined 4,182 users of a COVID symptom study app who had tested positive or were consistently logging their symptoms. So out of that study, 1 in 20 people with the virus are likely to suffer symptoms for at least 8 weeks. So 1 in 20 is a pretty big number from that. And then about 1 in 50 suffered symptoms for longer than 12 weeks. So just to kind of, in conclusion of this part, long-term COVID does affect every kind of patient. It hits both the old and the young. It can affect someone with pre-existing conditions and someone with none. For example, the ICU nurse, she actually had no pre-existing conditions and was in excellent shape. Just wanted to kind of emphasize that. Next slide, please. So the most common symptoms of a long hauler obviously are kind of just mimicking the same as just COVID-19 in general. They have coughing symptoms still. They have the ongoing fatigue, body aches. They feel a lot of pain in their joints, shortness of breath, which is just kind of, again, that damage or that affecting of the lungs. The loss of taste and smell continues. They have difficulty sleeping. The headaches are kind of becoming more chronic. And then also kind of a little new versus just COVID-19 in general was a lot more brain fog and a racing heart rate. So it does really affect your heart. And then also that brain fog, meaning that their minds are just kind of clouded. They may have trouble remembering things. They just feel a lot of stress. And I think anyone with any kind of chronic condition does kind of feel a little bit of a stress or feels that burden now of a new condition that before they didn't think that they would have even a chance of getting such severe symptoms from, and now they have to learn how to live with that. So next slide, please. So this is a image that actually the nurse put into my library of learning about long haulers. As you can see here, I know it's really small, but this is the biggest I could get it on the slide. It's just kind of going over all the different symptoms of long-term that the COVID long haulers are experiencing. And there's some words in black where you can see brain, head, heart, lungs. And it just kind of is trying to show you all the different symptoms that fall under each type or part of your body that it can affect. As you can tell, the lungs have a big kind of little section, and the bigger the circle around the symptom, it means the more the people are experiencing it. So difficulty breathing, the muscle aches, the fatigue, the inability to be active, and then the difficulty breathing. So those are like the darker blue circles. And then seeing that actually a lot of the long hauler symptoms are also affecting their brain. So that's the memory, that's difficulty sleeping, difficulty focusing, the dizziness, loss of taste and smell. All of that is just coming from our brain, and it's just a heavy toll on our brains if you are experiencing those long-term symptoms. So I just thought this would be nice to put in and just to kind of show you that long hauler symptoms aren't just the few that I showed earlier of the most common. Long hauler symptoms include all of these and could potentially include more now. Next slide, please. So the organs that are mostly impacted with COVID-19, and if you're experiencing those long hauler symptoms, are primarily your lungs, because COVID usually begins as a respiratory infection, and it's associated with a type of pneumonia that can cause long-term damage to the alveoli in the lungs. So I see a lot of patients that their primary diagnosis is pneumonia, but then you go and see that they also have COVID, and vice versa. They have COVID and then they come back to our hospital because now they've contracted pneumonia. So they kind of go a little bit hand in hand right now. And then for your heart, it does show lasting damage to the heart muscle. Damage to the muscle increases the risk of heart failure or other heart complications in the future. So a lot of what they're experiencing is like heart arrhythmia. So they have like a racing heart rate, which then in turn is causing that lasting damage. So the question, does this apply for those who did not have symptoms or just mild symptoms? So typically, as of right now, it shows that people that they could have had mild symptoms, but basically, if you didn't show symptoms, it's not very likely that you're going to become a long hauler. Really, that key thing is that if you experienced a lot of symptoms at the beginning, then it's more likely that you have it later on. With the nurse, actually, she ended up in the hospital for a couple days in that first week. So then for her now, she still has those symptoms and is still having to go back to the hospital with a bunch of specialists. You're welcome. And then brain COVID can also cause strokes, seizures, and that syndrome that I can't pronounce, but it causes temporary paralysis. So it's causing a lot of damage to the brain. And I mean, a stroke just a stroke in itself is very hard to recover from. It takes weeks, months. It could take a speech therapy. It can take physical therapy. It takes a lot of recovery. So this is how we kind of see how COVID can really create an impact in someone's life and really put them at risk of really bad effects. So kidneys and liver, the COVID also causes blood cells to form clots in the body, weakening our blood vessels and potentially long-term problems with the liver and kidneys. So that's just another one. I think the really primary organs, though, that they're affecting is definitely your brain, which controls a lot of your body, your heart, and then also your lungs. Next slide, please. So just in general, how to function with chronic illness. I wanted to just kind of throw in just more in general, just because not everyone has experienced COVID, but also a lot of us even have like pre-existing conditions or have these chronic conditions that we have to learn how to live with. But also in the sense of if you do develop that long-term COVID, one of the primary things to do is to learn about and understand your condition. A doctor can diagnose us with something and we maybe just kind of accept it and just kind of maybe get a little sad about it. What should we actually do, though, is to learn about that condition, understand your condition, and acknowledge those new limitations that you may have due to a disease that you have or a condition that you now have. Speak to your provider about your emotional health, not just physical. Find your support system. That can be family, friends, neighbors, and even support groups. So actually, due to the fact that we have more long-term COVID occurring now, even amongst our own employees, we actually started a support group for our employees who have been experiencing long-term COVID, and they meet once a week to kind of just go over all these new symptoms that they're experiencing together and everything that they're going through. Also, just in general, making goals, both big and small, and practicing mindfulness. Next slide, please. So just a mindfulness type of approach, or what kind of implies being mindful. Mindfulness encourages us to find peace and a sense of control over our situation. I think that's really important to say that we want to be able to feel like we're in control of what's happening to us, and reflect on what is most meaningful and important, and treat ourselves and others with openness and compassion. So for people living with chronic illness or long COVID, it's important to take care of both body and mind daily. So although these diseases are causing significant stress on ourselves, as well as feelings of powerlessness and frustration, by practicing mindfulness, you're helping people stay more rooted in the present moment instead of worrying about a future that does not yet exist. So
it's important that part of the support. And one of the questions now is, do you have support groups in Spanish?
So in general, yes, we do. In regards to like other conditions, in regards to the long COVID, I don't think right now that they have really opened up yet to like patients and whatnot. I think by addressing or looking at the need, we probably would. Due to our location in Chula Vista, we actually really do try to keep that English, Spanish. I know like with our other support groups like breast cancer and stroke, we do have them available in Spanish as well, just based on our population. But I think in the future, if we do see that long COVID is starting to affect more of like our population and our patients, that we would be willing to do both English and Spanish for them. As of right now,
yes, it's important that people get conscious about all those side effects and continue to have the conversation with the providers, so more awareness about the long COVID syndrome is out there. I'm looking at the clock, and I do want to have the full testimony of our on the video. So I'm just alerting about the time.
Yeah, I think we're close. Oh, I'll just kind of summarize the rest. Okay, so just um, the theory or the main theory of someone having long-term COVID is the fact that the virus exists in some small form still, even after weeks and weeks and weeks of having had the virus in the first place. So it seems that maybe our immune system is continuing to overreact, even though the infection has already passed. That's just a theory. So again, another thing that's been theorized is that long-term COVID is creating this chronic fatigue syndrome, or the ME/CFS. So basically, how we know that we're still feeling that like fatigue, those body aches. They're thinking that these patients are contracting this type of fatigue syndrome and it's continuing. But unfortunately, we still don't really understand this either, or this syndrome either. So it's just kind of what we're realizing right now. Next slide, please. And then another thing is the POTS syndrome, which actually our ICU nurse is experiencing now. So it's just another syndrome that she has, that is her body's inability to regulate the own heart rate. It's that dizziness, lightheadedness, problems with memory and concentration. So it's still continuing that brain fog, that fatigue. So really related to her brain. So this is a failure of the nervous system to be able to regulate certain body functions. So heart rate, blood pressure, temperature, respiration, all very important to our bodies. Next slide, please. So lastly, just because the disease is so new, we don't have that much information yet about long-haul COVID cases and care. It's still pretty anecdotal, meaning kind of how I'm about to show you a testimony of our nurse. Not a lot of people are really out there advocating for these long haulers. Our nurse actually has been on the news a couple times locally to try to promote that awareness, just because some of these patients are just kind of experiencing this, and they're experiencing it alone. They're not really going out there and really trying to share their story. So more and more right now, we're bringing together research, we're bringing together our providers and helping these patients be able to share what they're experiencing and be able to learn more about them. And in turn, that'll help us know how to support and care for them. Next slide. Thank you. Okay, so yeah, that's her video, if you can click that.
So as we see, this was recorded back in November, and the name of our nurse, Mariana Cisneros.
I don't know if the sound is on.
Yeah, most likely David is checking the settings. Oh, then we have a question, Andrea, regarding what agency is Mariana on? Could you respond to that?
What agent, like where she works?
Yes, Mariana Cisneros.
Yeah, she works at our Scripps Mercy Hospital in Chula Vista. She actually used to just be kind of a regular nurse, and then recently, well, around the time that she contracted COVID, she was starting her specialized training in the ICU to start treating those patients. But then obviously contracted COVID and has just recently started working again. But I think she's just doing more general supervision of nursing now.
Thank you. Let's check with David again. Well, David continues to check on the audio settings. We have here a comment from actually one of my staff members, Rebecca, indicating that this information actually is helping her a lot with a family member, long hauler, and has been a concern of theirs. And now she has some answers to some of the questions that they have experienced. So she thanks you, Andrea. And the more we talk and address this topic and raising awareness, then it will go beyond anecdotes to fully being research proposals and studies, because as we know, with any new condition or disease, it's not only the immediate impact, but most likely we will continue to be learning about COVID and their devastating effects on some individuals, not everybody, for some time on, including pregnant women, including younger and older adults. There is another question here about something mentioned earlier. Oh, assistance with interview clothing from a radio station? No. Is the name of our family resource center that has an actual closet free of charge by appointment only. It's called Rayo, a ray of hope. Rayo de Esperanza, and it's in the Otay Elementary Campus, 1653 Albany Avenue, so Chula Vista. And there, if you make an appointment, we have our staff members there, and with an appointment that the closet can be visited. We sanitize everything prior and after the visit, and can take some of the resources available there, men, women, and children. You got it, Rachel? Okay, let's move on with David. Says that he's working on his end. Let's kind of, and if we cannot play the audio now, what we can do is once we upload the slide, I know that the video is embedded in the slides. So if you later can download this presentation along with the other materials, you will have it there. Next time, we'll make sure that if you include a video in one of the presentations, we're gonna get the audio separately, so we can just play it independent from the slides. Okay. So do we have a slide after the testimony from Mariana?
No, that
was it. Okay, so well, we apologize for that. We will be better prepared next time and test it in advance. And actually, Rebecca just typed out the information I read out loud about the closet available at Rayo de Esperanza in Albany Avenue in Chula Vista. And the phone number to make that appointment for your client is 619-425-4458. We have community resource specialists or promotoras de salud right there. And with all the precautions that are needed, you will have access, your client will have access to the closet resources. Oh, David, do you have something else for us? We have had lined up Tavaris Franklin with his presentation with the San Diego College, but I think that it would be, let's see, in terms of time, Franklin, do you want, sorry, Tavaris, would you like to have it with more time on our next call in March? So you don't feel rushed?
No, I can do it in however much time we have.
Okay, well, speed it up. We have 8 minutes.
Okay.
That works for me.
Thank you, Tavaris.
Sorry and apologize for, technology will go wrong when there's an
I know,
opportunity.
it just happens, right?
So my name's Tavaris Franklin. I'm from Continuing Education. We just went over a name change. So we're now San Diego College of Continuing Education. We still provide free certified and certificate training, as well as free welding, free plumbing, free HVAC. I got a whole presentation right here. I'll just go off of that. So before when it was a normal world, we had 7 campuses. We embarked on a huge endeavor by moving all of our programs 100% online. For this semester, we were able to hybrid 2 so far. We hybrid our clothing and textile that's held at West City, and our welding course. That's the only one that you can take as a hybrid, meaning that you could go in person a couple of days and you could do the rest of your work online. Next slide, please. Distance learning, we're all going through it right now. I just finished my master's program, so I understand some people who have perceived in the real challenges of distance learning. We make it easy though, free tuition, it's fully online. We do have programs and certificates that you can receive in 3 to 6 months and join the workforce. But typically, most of our certificates will take you a little bit under a year or 16 months to complete Czech or automotive, a lot of our popular certificate programs, like CNA as well too. We prepare students either for the workforce, or we prepare you to transfer to the local community college or university that you have in mind. So San Diego Continuing Education is part of City, Mesa, and Miramar. So when we actually help students, you can either take a refresher course or you could take your GED, high school diploma, ESL courses with us.
And
or
we
you
have a
could just
question
sharpen
here regarding how long are these programs, like the welding?
Yeah, so the welding it depends on what type of welding you're going to do. But if you do the full suite, you're looking about 18 months. And it's a free program. In terms of the only thing you need to purchase is your boots. So everything else is provided for you. Next slide, please.
Thank you.
Before, when we were serving over 44,000 students, it's probably more now because we're able to open up our scope. It's a very diverse campus. 100 countries are represented there, and you'll see everybody from children when we had our daycare there for our parents to the elders who are in our emeritus program too. And we do provide free digital literacy courses. So I know sometimes myself or my son gets a little frustrated when my wife doesn't know the technology or when his grandma doesn't know it. So while they're doing distance learning, you can start learning some digital literacy, and those are completely free. Next slide, please. A little bit else what we offer is English as a second language from beginning to advanced. So that's either you'll advance to transfer to the community college or just a better command of the English language. But we also have vocational ESL. So say you're an individual and you're wanting to take automotive and you're still getting command over the English language. What we do is we embed in that course the vocational side for the ESL as well too. And we have a DSPS program, and just like the colleges, we have a lot of wraparound services. So I know when we first started this pandemic, we worked with organizations to provide laptops and mobile hotspots for our students, because we found out that a lot of our students just didn't have the technology or the finances to afford it. And we just started an apprenticeship program for the construction trades, where you could get paid $16 an hour for 80 hours of paid work. So that's a game changer too. And for those who are looking to take citizenship courses, we offer that for free. We have our emeritus program, the parent education. The only thing that we charge for is your community education courses. And they're very, there's a low fee to those because they're ran outside of, in partnership with continuing education, but everything else is completely tuition free. Next
And we
slide.
have more questions before going on regarding when do classes start?
So
And
classes have already started and we're open enrollment, open exit. So our classes started February 1st, but the beauty about continuing education is we have courses that start all year round. And what we do is, since our courses are free, that doesn't mean that you're getting a low value. These are high quality courses that I used to work at Concord, and the CNA program was $15,000 at that time. And you'll see that with the for-profit schools. But at continuing education, that course is free, you know, and we help you with a couple of the other tools around that too.
and would those courses be transferred to college credits?
Yes, they have that ability. So since we are partnered with we're part of the San Diego Community College District, our automotive program is free to the student. If they get a B or higher and take the credit by exam, they turn that free program into 23 transferable units to the Miramar Auto program. And the same thing works for HVAC, for culinary, for a fashion program. Students have the ability to take these courses for free. And if they do the credit by exam, they now have turned in that free course. They get their certificate and they get free, free college courses that translate to our community colleges. So that's a game changer because it's $46 per unit for a college course.
Mm-hmm.
So
Yes.
23 times $46 is a little bit over $1,000. That's how much money you would have saved for that.
And we also have more questions regarding that digital literacy course. Can you tell us more about the outline, the content of it?
Yeah, it's basically like your introduction to digital literacy. So how to search the browser, how to use use Google, how to search, how to use just your entry level literacy regarding technology. But I can also send the class schedule and the flyers for the programs that I'm talking about.
Yes, please do so, because we're going to upload all this and people will be able to download it from our website at their leisure.
Okay, so I will do that right after the call. Who should I send it to? Just
to me, Brendaly.rodriguez@cvest.org. And if you can include information about sign language courses, if you have them as well.
Yeah, I'll send you the class schedule and it has everything that we're offering. And then you can always go online and see if there's a new class, but the class schedule is very useful and helpful.
And does it include bilingual classes?
Yes, we do. And it's part of, when you're taking ESL, those are part of the courses that's going to help you get a command of the English language. But we do offer a couple of other foreign language courses as well. And we have a veterans program too. So we have 4 VA approved programs where dependents or VA veterans can actually use their benefits at continuing education. And we have, most of the time, we've been successful at being able to provide the digital books to our students. So not only is tuition free, but the books are free too for the most part, unless it states that you're unable to get the book digitally for free. However, a large amount of our programs, books are completely free.
I see, and people are expressing interest into that Success Resource Center. So they are also asking about any prerequisites.
Any prerequisites? Yes,
Yeah.
there's only one prerequisite to attending continuing education. You have to be 18 or over. Regardless of citizenship, regardless of financial wealth, or if you're challenging financially, I won't talk about financial aid because financial aid is not, the FAFSA application will not be used at continuing education. And it's something that we all pay for with our taxes. Those classes are provided to help the mobility of our community in terms of being educated and being able to have gainful employment. So a lot of these certificates, you're looking at, if you were to go to a for-profit, about 15 to 20,000 easy to take the automotive program, to get your HVAC certificate. And we have our career and college transition. So we have individuals who help you find a job, help you with your resume. They actually help you do the job coaching and everything else like that. So you're really getting wrapped around services when you come to continuing education or when you come to our district, whether it's City, Mesa, or Miramar.
And Tavaris, one last question regarding the digital books. Are those free or only provided via digital or hard copies?
For the most part right now, they're provided digitally, but I don't know if you could get the physical copy. We pretty much limited all contact with our students. If it's not giving them like their actual laptop and their mobile hotspot. We used to even have a farmer's market every first Wednesday of the month, but we had to cancel that, but we still partner and promote food markets around the county.
Thank you. Thank you so much. I do appreciate that you used our last section of this call to kind of present to us all that information. I'm looking forward to collect all those flyers and specific topics as we have highlighted in the chat log. And David will be uploading all these slides, flyers this afternoon. So hopefully tomorrow onwards, you can check them out and download.
And the high school diploma program and the GED are self-paced, or you could take it in sections with the cohort.
Excellent. Thank you. Thank you. And I see many thankful messages to Tavaris today. And I know that I'm conscious of time, 10:30. I really appreciate all our speakers today and all of you who attended this call, the February call on Black History Month for the Chula Vista Community Collaborative, and invite you to join us again on March the 9th for our next call. Slots are available, so if your organization wants to share information on your programs, please send me an email at brendaly.rodriguez.cvesd.org. And if you scroll up the chat box, I have typed that out already for you. Our next calls are going to be on March 9, April 13, May the 11th, and June the 8th. So thank you so much, everybody, and have a blessed day. Thank you, David.